Rheum pathology, Sjogren's syndrome, as well as septic arthritis. All right, so for Sjogren's syndrome, this is going to be an autoimmune. Once again, this is why it's under Rheum, right? It's going to be autoimmune disorder characterized by destruction of exocrine glands, okay? So you're going to see destruction of exocrine glands, specifically the lacrimal and salivary glands, all right? And so that's going to show, that's kind of just hinting towards the findings you're going to see, okay? But I just want you to know kind of the process in which Sjogren's syndrome occurs. But what they want you to know is that this destruction is usually by lymphocytic infiltrates. Okay, so if you see periductal lymphocytic infiltrate with focal lymphocytic sialadenitis, okay, that is very pathognomonic for Sjogren's syndrome. Okay, so it's periductal lymphocytic infiltrate with focal lymphocytic sialadenitis. Okay, focal lymphocytic sialadenitis. All right, so those are two key high yield things for Sjogren's. You're already pretty much we're about 80% through Sjogren's. That is the highest yield stuff that I can tell you. Okay, so it's autoimmune destruction of exocrine glands, like the lacrimal and salivary glands, and it's due to lymphocytic infiltrates that cause focal lymphocytic sialadenitis. Okay, it's usually going to be in a female, 40 to 60 years old, and the findings I'm sure you can expect are keratoconjunctivitis, which is just decreased tear production. Okay, so you're going to have decreased tear production, so they're going to have dry eyes, right? So they have this feeling of dirt in their eyes is what they'll say. Xerostomia, which is decreased salivation production, decreased saliva production. So they're going to have very dry mouth, fissuring of the tongue, mucosal atrophy, okay? This all makes logical sense, right? Now, other findings that you have to know is that there's going to be presence of anti-nuclear antibodies and rheumatoid factor. So those can be positive, but the key positivity that you need to know for the antibodies are SSA, anti-Rho, and SSB, anti-La antibodies. And that's very high yield for Sjogren's. So if you see anti-Rho or anti-La or SSA, SSB, they're talking about Sjogren's syndrome, okay? It can also be seen in lupus, anti-Rho and anti-La, but it is also associated with Sjogren's syndrome, okay? Now, complications are going to be dental caries because you have decreased saliva production, which is protective against dental caries. You can see lymphoma, okay? Lymphoma is usually going to be present unilaterally as parotid enlargement. So parotid unilateral enlargement can be a presentation in Sjogren's that hints to you that it's a lymphoma, okay? And patients that have Sjogren's have an increased risk of giving birth to a baby with neonatal lupus, okay? Neonatal lupus, which is also important for you to know, all right? So overall, Sjogren's disease. First off, autoimmune destruction of exocrine glands, specifically the lacrimal and salivary glands. So you're going to see keratoconjunctivitis, SICA, which is decreased tear production. So they're going to have dry eyes, like gritty sand feeling, dirt in their eyes. And xerostoma, which is going to be decreased saliva production, which leads to mucosal atrophy and fissuring of the tongue, and very, very dry mouth with increased risk of dental caries. It's going to be due to lymphocytic infiltrates, periductal lymphocytic infiltrates, that can cause focal lymphocytic sialadenitis. Okay, on labial salivary gland biopsy. That's how you confirm the diagnosis. Focal lymphocytic sialadenitis, very important. It carries an increased risk of lymphomas, which will usually present as unilateral parotid enlargement. And the positivity is ANA, rheumatoid factor, and specifically SSA anti-Rho and or SSB anti-La. So that's Sjogren's syndrome. If I were to tell you the highest yield thing, periductal lymphocytic infiltrate with focal lymphocytic sialadenitis is going to confirm your diagnosis, and you're going to have increased risk of lymphomas. Okay, those are kind of the two high yield things, and the presentation is going to be very, very similar to what you would expect. Dry mouth, dry eyes, stuff like that. Next is septic arthritis. So septic arthritis, the most common causes are Staph aureus, Streptococcus, and Neisseria gonorrhea, okay? Those are your common causes of it. Now, the joint is going to be swollen, red, and painful, okay? But the difference between gout and septic arthritis is going to be our white blood cell count of the synovial fluid, okay? And that's going to be above 50,000. And in most cases, it could be even 100,000. If you see that synovial fluid, like way above 50,000, even past 100,000, put septic arthritis. That is your answer, okay? Now, treatment is going to be antibiotics and aspiration as well as drainage, right? We don't want to have irreversible joint damage because of the septic arthritis. Something that's very high yield associated with septic arthritis is disseminated gonococcal infection. So although you might remember reading about or watching the sketchy video about gonorrhea and Neisseria gonorrhea, they don't really discuss disseminated gonococcal infection. They somewhat do, but not in full. So this is when your sexually transmitted infection of gonorrhea can become disseminated and cause systemic symptoms. okay? The first one is going to be septic arthritis, right, which we've already discussed, and it is in the sketchy video, which is like purulent arthritis, usually of the knee. And you will also see a triad of polyarthralgias, so multiple joint pain, tenosynovitis, so you're going to have essentially like hand tendinitis, so like hand pain of your tendons in the synovial fluids. And you can see dermatitis. So if you see multiple pustules around the skin, that is indicative of disseminated gonococcal infection. And that's important. They don't talk about it in sketchy, but that dermatitis with pustules on the skin, it's very weird, but that's going to give you the hint with septic arthritis and tenosynovitis of disseminated gonococcal infection. All right, and remember, keep in mind that white blood cell count being greater than 50,000. All right, so that's our Sjogren's and our septic arthritis. We're going to move on to the seronegative spondyloarthritis in the next video.